The digital maturity in a hospital and healthcare provider, each and every clinical data. I'm more emphasizing more on the clinical data perspective. A non-clinical data has been deployed, adopted 100%.
How do you ensure alignment between, clinicians and business leaders and IT teams during major transformative initiatives?
Change management will be very easy and the adoption will be much better. Maybe start from 80 to 85% from day one onwards. So this is the second part. The third part is, if we're talking about the challenges perspective, I'll say that across the globe, people are digital and they like to work on the digital platform, but not in a scattered manner. It should be meaningful outcome. It keeps showing to them when they are using the application, clinical application.
Hi, you're watching The Mainstream. I am Simran Shiwalkar, your host for today. Today, we are joined by yet another visionary leader, Mr. Abdullah Saleem, the Group Chief Information and Technology Officer at Alameda Healthcare, bringing more than 2 decades of experience with various geographies, right from India to the US and UK, Europe, the GCC, and the Africa region as well. I'm more than excited to deep dive into his experience, his journey, and gain some incredible insights from him. So, without any further ado, let's begin. Firstly, Mr. Salim, thank you so much for being a part of the series and joining us today.
Thank you very much.
Absolutely. That being said, as we are all aware, more than 2 decades of experience, 25 years in healthcare, IT across various geographies. Can you tell us how this journey has been? What core experiences have, shaped your philosophy as a tech leader in the healthcare industry today?
Thanks for the questions, and it's very renowned questions. Let me answer on your questions. My experience across diverse healthcare system has shown me that technology creates impact on only when it is clinically on ground, interoperable, and focus on outcomes rather than the tool. Working globally has shaped my belief that patient care is elevated when digital solutions simply clinicians work, enable data-driven decision, and keep human at center. So, if you'll see my experience perspective, I have spent more time on the clinical adoption, clinical change management. So, if the clinical application is not deployed at any organization, then it doesn't make any sense to talk about any kind of accreditation and so on and so forth. So, as I said, philosophy I follow throughout the my experience in that PPT methodology, people, process, and technology, which has given the great impact in terms of executing and get the project executed successfully. The highest adoption from the day one onwards when the clinical application has been deployed to the various organizations across the globe.
Thank you so much for sharing your journey with us. And that being said, you have also led large scale EMR and EHR, clinical transformation. When we talk about hospital systems today, integrating various programs, when we talk about digital maturity, what does it mean we look at the medical or the healthcare institution?
If we talk about the digital maturity in a hospital and healthcare provider, each and every clinical data, I'm more emphasizing more on the clinical data perspective. A non-clinical data has been deployed, adopted 100% irrespective to any industry, and including the healthcare now as well. The maturity perspective, we talk about emphasize and the clinical adoption. And after the deployment of the clinical application, if the clinical adoption is not there, then the maturity goes nowhere in terms of any accreditation like HIMSS stage 6, HIMSS stage 7, and the JCI certification. So if the clinical maturity perspective, that complete longitudinal record of each and every patient in form of EMR, EHR is a bit away, but the industry is working towards this to cover up EHR at the largest scale. But EMR perspective, any data, any clinical data, whether it is consolidated by the nursing, any form of clinicians, means doctor, and then the data which is going to be coming from embedded system, CT scan, MRI, bedside monitor, and OT quality equipment, all those data which has got the clinical information, if it is being recorded and consolidated at a place, at a central place, and then on top of it, clinicians going to enable the quality healthcare in terms of clinical decision support at point of care. So majority of the hospital in terms of digitization, in terms of clinical transformation is only that if avoiding all these silos application, avoiding all the silos data and ensuring that meaningful data is being consolidated so that the strong CDSS clinical decision support is working for the healthcare providers. Healthcare providers may be form of nurse, form of any doctors, form of technicians. So until unless the clinical application is deployed and adopted 100% in an integrated form within the organization as in the definition of EMR with interoperability perspective, no matter how many applications are working in the organization, but it should be integrated to ensure that longitudinal records are being maintained and in a runtime it is available for the healthcare providers to enable and the quality healthcare, to deliver the quality healthcare, to have the better patient experience and the provider experience. Over to you.
Fantastic.
I hope I answered the question.
Absolutely. That said, CIOs or tech leaders today, especially when we talk about healthcare ecosystem, they face rising expectations around AI, data, compliance, and even real-time care delivery when we talk about industries like healthcare. From your point of view, what do you see today as the top three challenges that a CIO can prioritize for the coming years, especially now that we are closing down 2025?
So the very, very, very nice questions. We are 2024 and 25, mostly 2025, we were in the era of AI, but you understand that the healthcare deals with the human science, right? And the healthcare is different domain pertaining to the other domain because it's deal with the human life during the treatment. So AI definitely is going to help in terms of, it is not going to take decisions perspective, but it is going to help the clinicians, the end users to take the right decision. A kind of a prompt, the AI is going to be given to the patient in terms of information and to the clinician in terms of to taking the right treatment. So AI is the evolving stage in healthcare, though the other industries that they have adopted at the extreme, but healthcare industry is still in an evolving stage and it is adopting, and the maturity of the outcome of based on the clinical data, clinical guidelines is coming up, but the maturity of AI perspective is not reaching more than 70 to 72%. Based on that, the clinician will be owning the complete treatment protocol, complete treatment delivery for the patient. In healthcare clinical perspective, AI started playing a major role. Now we are thinking that why the huge adoption challenge across globe to have the 100% adoption of clinical applications from day one onwards. So recently that the conversational AI has come in the between where the patient and doctor doing the conversation with the accuracy of 70 to 72%, and automatically the present, past history, and the prescription, including CPOE, is automatically done. And then the doctors take just a view of that. And if you want to make a change into that, he can just do the changes and then submit the prescription. In that case, what happened that the huge challenge, the doctor were saying that we are not a typist. So if I'm trying to create my prescription manually in 3 minutes, why don't your technology can do in 3 minutes? I'm not asking 2 minutes. So that this AI has come up to that level of maturity and helping it to the clinicians to fasten their clinical documentation on a large scale, including as soon as the patient conversation is being done, automatically the system is the provisional diagnosis, sign and symptom is captured, and based on that, the treatment protocol, treatment clinical pathway is getting enabled and is getting pre-filled as well into that, whether it is inpatient, outpatient. In terms of inpatient, prescription is ready with less than 3 minutes. In case of inpatient, the daily assessment sheet is not required to creep on manually. It is phone, just you can speak out. The treatment of the inpatient also is being taken care of. But again, after that, doctor has to review what the outcome has been given by the AI and then sign off. And the doctor is going to own that record, what the treatment plan, treatment record, the way he has given, rather than AI is going to own.
Right.
I hope I answered the question.
Absolutely. My next question to you, Mr. Saleem, is you have managed mission critical programs right from end to end end, from delivery to change management, how do you ensure alignment between, clinicians and business leaders and IT teams during major transformative initiatives? Is there any major roadblock or a common challenge that you have observed?
So there is three questions. Let me answer one by one. Okay. Generally, I ensure alignment by establishing a shared outcome framework. Clinical, business, and IT goals are translated into a common success metric.
Right.
That's first part. Second, the early and continuous engagement supported by strong governance and clear communications keep all stakeholders aligned throughout the transformation journey. So this is what I put in mind whenever we do any kind of clinical deployment across the hospital group. So this is the starting point, we keep it. And if we talk about the challenges perspective, whenever we go for any applications selections, we ensure that three things. The application should be faster than paper. It should have a sub-second response. And it should have been designed in such a way that the clinician does not require any training. So that's these three important parameters we look at. And if it is not, then we ask to the vendors to work on these parameters and come up and then showcase their product, and then we sign and move forward. If these three parameters and mantra has been taken care of into the building the clinical product, are having these feature in the clinical product, then the challenges will be very less, and change management will be very easy, and the adoption will be much better. Maybe you start from 80 to 85% from day one onwards. So this is the second part. The third part is, if we're talking about the challenges perspective, I'll say that across the globe, people are digital and they like to work on the digital platform, but not in a scattered manner. It should be meaningful outcome keeps showing to them when they are using the application, clinical application. So the challenges comes rather than technology challenges nowadays. The challenges are the people and process. So let me give you an example of people, process, and technology. And these three components is required to deliver any product, any project into the healthcare. It will be partner, vendor. I will not say vendor, but partner and the organization should work together and following the methodology of people, process, technology. If out of 100% project, people caters 35%, process caters 35%. These people and process caters 70% of weight of the project, and technology just a 30%. So technology is not a challenge. The bringing the right people and mapping with the right process and then map the technology, then it gives wonder. If not, doesn't matter. Even if we have taken a very high and very costly product and the people and process is missing there, then it will be a disaster, and that will go nowhere. So I hope I answered the question of what we have asked for.
Absolutely. And thank you once again for sharing your insights on that, Mr. Saleem. Before we wrap up, I also want to understand from you, looking ahead, what seems like a long-term vision for the industry that you come in from, especially healthcare, with Alameda's healthcare digital journey. Which innovations do you think will kind of dominate or prove most essential, whether it's to improving outcomes, efficiency, or patient experience?
There is, as far as the Alameda is concerned, AI-based robot we have introduced non-clinical area. For example, let's say that if you are visiting to the hospital and there is a robot and you say that, may I help you? And you understand the new person has come and may I help you? You say yes. And you ask a question that I need to go to the reception, or I need to go to the oncology or radiology or particular doctor chamber. Then it guides to you and it's accompanied to you and take you there and ensure that you are get inside. Then he thanks and come back. So that we have already implemented, and as a POC in terms of how the AI is working perfectly, because there is no risk into that. It's not dealing in the clinical. But in the same concept, if we'll talk about the clinical perspective, what Alameda Healthcare going to consider in 2026 and 2027, it will be an AI-based chemotherapy manager we are going to bring into the place. AI to drive the insurance submission invoice, robotic in clinical and administration area we have already covered, but in clinical area we are going to put in, and AI-based infra security posture having better safeguard. We are in the verge of, and I hope maturity level out of CMMI maturity level, we have just achieved a 2.6 out of 5, but we are very soon we are going to achieve 5 with the help of AI. Then unified digital foundation, we are going to put it in terms of EMR and EHR. Clinical driven transformation, we are going to put in. AI enabled efficiency, we are going to put in place. Data driven leadership, we are going to put in, because it will be data driven leadership means based on the AI. Patient-centric experience, of course, we are going to introduce interoperability and scalability. We are going to put it on a private data center and the way it has been put on the public cloud. So, but we have a private cloud and we are going to put that AI to make it scalable rather than manual intervention. And then, as I said, that the maturity level, CMMI maturity level, we have achieved the security and trust by design to strengthen the cyber privacy and compliance, protect patient data, and sustain confidence. So this is what we are going to do at the Alameda most in the 2026, and we have budgeted and we are geared up to deploy AI components large scale. Over to you.
Thank you so much, Mr. Saleem. Brings me towards the end of this conversation. But thank you once again for sharing your insights and your perspectives. While we wrap up, I most certainly look forward to connect with you again.
Thank you very much. Thank you very much indeed.
Thank you.